Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to welcome you to episode 207 of the Ask Dr. Angela podcast. So, it's so good to be back. I think I recently just shared with you that I took a week of vacation and it was amazing. It was the first time that I've been completely disconnected from everything. I didn't even answer my phone. I didn't respond to any text messages. My wife, we took her phone so that we, had something in case of emergencies. But my little one said to me, "Mommy, this was the best vacation ever." My wife actually concurred because she said, "Ange, you were 100% present." And I think really for me, the favorite part was being 100% present. I wasn't on my laptop at random hours in the morning because I'm a really early riser. And I was able to read books, laying in the sun in a hammock. I was on the beach every day. I was at poolside, eating wonderful food. The people were so nice. We watched movies. We just hung out. So this was a really good mental health break for me because my job is extremely stressful and I am on all the time. So it was just some great downtime for me. But now that I'm back into the swing of things, we're completely back into Dr. Angela mode. And that means that I'm reading all the time, I'm writing all the time, I'm listening all the time. And I recently came across a really interesting article on preventing tears at the time of delivery. Because, that's one of women's hugest fears, at the time of delivery. Nobody wants to tear. No one wants an episiotomy. And so just yesterday, in fact, I was catching up on some journal reading and I came across a mnemonic called Safe Passages. And, this series of interventions they found significantly reduced the incidence of trauma during the birthing process. The research was done at, I think, a military hospital. And so I found it to be very interesting. And so I thought I'd share it with you. And the mnemonic behind Safe Passages, which again is a protocol to reduce perineal trauma or tearing during delivery, is as follows. SAFE stands for the S, start perineal massage at 36 weeks. So there you go, ladies. Massage that perineum starting at around the 36th week of pregnancy. And I would recommend using olive oil, coconut oil, or something so that you can help to relax and start stretching that muscle. And for those of you that don't know where the perineum is, it's the skin between the opening of the vagina and the rectum. The A stands for alleviating fear and anxiety, and that's your doctor's role to make you feel safer and less anxious about having a vaginal delivery. The F stands for facilitating an occiput anterior presentation, which means, again, that's for your doctor. Sometimes babies are OP, which stands for occiput posterior. In English, that means babies sunny side up or looking upwards. And sometimes your OBGYN can help to rotate baby so that baby's looking down. Those deliveries are much easier. And then the E in SAFE stands for eliminating midline episiotomies. If you're going to need an episiotomy, it really should be more lateral to help to prevent an extension into the rectum, which is no bueno. But I'm going to be completely honest with you. The number of obstetricians that are routinely doing episiotomies should be really minimal because ACOG doesn't endorse that and hasn't endorsed that in a long time. The P in passages stands for placing a warm compress in the late second stage of labor. So that's right before you're getting ready to deliver. The A stands for adducting the thighs at delivery. They recommend 90 degrees or less. And also the S for straightening the legs at the time of delivery. These are things that your physician and nurses should be well aware of. And then the other S, which I'm a huge supporter of is supporting the perineum. Helping to support that tissue so that you minimize the amount of tearing. And the residents and students that work with me know that I am huge on this. The A stands for aiming at a lateral episiotomy if needed. We talked about that earlier. G, go slow. It's not a race. So you want to have a slow, controlled delivery of the baby's head, making sure that it remains flexed so that you don't have any, or that you have as little vaginal trauma as possible. E in passages stands for excelling at operative delivery, and that's more for your physician. They should be skilled at a vacuum or forceps. And most physicians these days aren't using forceps anymore, only because it's kind of like a dying art. A lot of my old school attendants were really skilled at using forceps, but I'm more of a vacuum girl myself, and that just has to do with training. And then the S in passages stands for superb repair technique. So if you do have a laceration, your physician or OBGYN should be able to repair it with excellent technique. So I loved that. I loved this mnemonic, safe passages to help reduce tearing at the time of delivery. And I certainly plan on not only remembering it, but implementing it in my own practice. That's why I love reading. That's one of the reasons that I decided to become a physician, because there's constantly learning to be done. I mean, it's like the gift that keeps on giving. That's why medicine is never boring, because it's constantly evolving. So that was informative, right? If it wasn't informative for you, it certainly was informative for me. I thoroughly enjoyed that article that I read in one of the 1,000,005 journals that I get, it seems like, on a daily basis. So thank you so much for tuning in. If you want to check us out further or follow along, reach out to us at www.askdrangela.com. That's AskDrangela.com. That's where it's all going down. You can sign up for my weekly blog post, my podcast series, as well as our YouTube video series. If you have a question that you would like featured on the podcast, or if you want me to write about it in a blog post, you can submit that again at www.askdrangela.com. We would love to hear from you. You can follow us on social media. We are everywhere. In closing, I'd like to leave you with this. If the opportunity exists, I will find it. If not, I will create it. Until next time, look better, feel better, be better. Looking forward to reconnecting on episode 208 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.